Okay, so this is just a quick overview of our V200 alarm system. When you come in to see the ventilator, it's going to be on the monitor screen, and this is where you will look for your ventilator settings. Right here are your settings for your ventilator. You'll see the rate, you'll see the tidal volume, you'll see the percent FO2 and the PEEP. Those are the main things that nursing records in their documentation. The active mode will always be lit in green. See, the active mode says volume control, assist control. So they're on assist control, rate of 12, tidal volume 300, 40%, and PEEP of 5. Okay, as far as alarms, basic alarms, and respiratory therapy is responsible for setting the alarm settings. The main alarm is going to be high pressure alarm, and we'll see this here in just a minute. Whenever it highlights in red, it means it's a high priority alarm. This is the alarm silence button. If you just hit that button, it will turn off the audible alarm. However, it will keep flashing red, high priority, until the alarm situation is corrected. So when you see a high pressure alarm, the most common cause is the patient is coughing, has a lot of secretions, and need to be suctioned. So you will want to assess your patient for suctioning, most likely. The only other thing that might cause a high pressure alarm is if there's a kink in the tubing or some obstruction in the airway, possibly a mucus plug, which there again, suctioning will relieve that. Another alarm is the low minute ventilation. If you'll notice that this one is yellow, which means low, and it's flashing yellow. That means it is a lower priority alarm. It's a caution alarm. Low, whenever you see anything low, it means that the patient is not getting the delivery, what the ventilator is trying to give them. Usually it is a leak in the system or a patient disconnect. It could be a cuff leak, a tracheal leak is not, the trach is leaking, something has come disconnected from the ventilator and there is a leak. Once the light quits flashing and it goes away from yellow, it actually means that the situation has been resolved. So you would just want to hit the alarm reset. These will stay there lit up until it is reset. When you hit the reset button, then it takes away. So if we have another alarm that alarms, it will actually start flashing again. So we're going to hit the silence alarm so that we don't have the patient being upset about it, and then we're going to assess our patient. Low inspiratory pressure means that, again, anything low means we're not getting delivery of it to the patient. If you keep getting the alarms, they keep going off frequently, call respiratory. They may need to assess the alarm settings, but before you do that, you need to assess your patient. First thing is assess your patient, look at their oxygen saturation, their heart rate, respiratory rate, if they need to be suctioned. If the patient is in distress and the alarms keep going off, then you will want to disconnect the patient from the ventilator and ambu them with 100% oxygen until someone who can come who can resolve the situation. If you aren't going to disconnect the patient from the ventilator, you will want to first hit the alarm silence button, because when you disconnect them, it will alarm. So go ahead and hit your silence button. That's also a good thing to hit if you're going to be turning the patient or doing anything that might cause them to cough. So once you hit the silence button, then you just will remove them from the ventilator. You will take your ambu bag, you will turn your oxygen flow rate all the way up to flush so that you have oxygen in this bag, and then you will ambu your patient. Okay. All right, so there is one more alarm, which will be, we're going to look at, which is our apnea alarm. We're going to have to mode. The apnea alarm more frequently will be when the patient is in the CPAP mode. We're going to go back to monitor. So you will see now the active mode is CPAP. So the patient is on CPAP with a PEEP of 5 and 40%. When they're on CPAP, they're breathing completely on their own. So if the patient quits breathing or they come disconnected, you're going to see an apnea alarm. Low inspiratory pressure.
The alarm's on, so.
Oh yeah, the alarm silence is on, I'm sorry. Let's do it again. It reset it, so it's going to have to wait. Anyway, if you do see the apnea alarm, the machine will automatically go into a volume control mode when apnea is detected. You want to check your patient for breathing. You want to check your patient for disconnect. We're going to... Okay, if you'll see here, it is already flipped back over to where it is giving a patient a breath now because they were apneic. Our little indicator here is showing that the ventilator is delivering a breath. And that is all for ventilator alarms.